Most people believe modern surgery was born in Europe. Scalpels, sterilization, cesarean sections. They're taught this is the story of Western medicine, but what if that story is incomplete? What if, deep in the heart of East Africa, centuries before antiseptics were standardized in European hospitals, African physicians were already performing successful cesarean sections with survival rates that shocked 19th century European doctors? In 1879, a British medical officer named Robert Felkin witnessed a surgical operation in Bunyoro, within the ancient kingdom of Kitara, in present-day Uganda. What he saw challenged everything European medicine believed about primitive societies. A woman in labor, alcohol is used as anesthesia. Hands and blades are sterilized with banana wine. The abdomen opened cleanly. The baby was delivered alive. The wound was cauterized with heated metal. Antiseptic herbs applied. The mother survived. This was not guesswork. This was a medical system. And here's the part most history books leave out. This knowledge was not imported. It was indigenous, passed through oral medical guilds, protected by royal courts, refined through generations of empirical practice. Kitara's healers understood pain management, infection control, surgical precision, post-operative care, all without microscopes, without European textbooks, without colonial approval. So how did a civilization in East Africa master surgery before Europe normalized antiseptic medicine? To answer that, we must go back further, to the origins of Kitara itself, to its land, its people, its technologies, and its forgotten brilliance. Because Kitara was not just a kingdom, it was a civilization system, and what we're about to uncover will change how you see African science forever. Long before Kitara became a political entity, the Great Lakes region of East Africa was already one of humanity's oldest homelands. Archaeological evidence around Lake Albert and Lake Victoria reveals continuous human settlement stretching back tens of thousands of years. Stone tools, early agricultural terraces, and iron smelting remains suggest that the ancestors of Kitara were not wandering aimlessly, they were engineering landscapes. Oral traditions of the Banyoro speak of the Batembuzi and Bachwezi, semi-mythical dynasties remembered not merely as kings, but as culture bringers. They are described as beings who taught humans how to live with the land, introducing cattle keeping, ironworking, and spiritual governance. While later colonial historians dismissed these figures as legend, archaeology now supports the idea that advanced early societies existed in the region long before written records. Kitara's origins lie in a convergence of early human evolution zones, fertile agricultural basins, mineral-rich highlands. This geography produced not just survival, but specialization. By the time Europeans began to write about medicine in East Africa, the kingdom of Kitara had already developed knowledge systems that blurred the line between what modern people call science and what they often dismiss as tradition. In 1879, a British medical traveler named Robert Felkin stood inside a surgical hut in Kahura within the Bunyoro Kingdom, a successor state of the ancient Kitara civilization. What he witnessed was not an emergency improvisation. It was a controlled medical procedure, performed with confidence, structure, and inherited expertise. A woman was laid on a mat. Banana wine was poured over the surgeon's hands and across the woman's abdomen. The liquid was not symbolic. It functioned as an antiseptic, its alcohol content used to cleanse skin and tools in a way European medicine was only beginning to understand at the time. Herbal preparations were administered to calm the patient, acting as sedatives. The woman did not scream uncontrollably. She was conscious, but dulled to pain. The surgeon then made a clean midline incision. The uterus was exposed and carefully opened. Observers recorded that the uterus was sometimes gently massaged to stimulate contraction, a practice consistent with modern obstetric understanding of uterine tone and hemorrhage control. The infant was delivered alive. The placenta was removed. The wound was then closed with iron needles, precisely pinned, and treated with layered herbal pastes that served as antiseptics and healing agents. This was not experimental medicine. It was procedural medicine. Felkin later wrote, astonished that both mother and child survived. At the time, this outcome was rare in Europe. Caesarean sections in 19th-century European hospitals were often fatal to the mother. Antiseptic techniques were still controversial. Surgeons moved between patients without washing their hands. Instruments were reused without sterilization. Many women died not from the operation itself, but from infection afterward. Yet here, in Bunyoro, survival was not considered extraordinary. Oral accounts suggest the procedure had been performed for generations. The surgeons did not act with the uncertainty of first attempts. They acted with the calm of inherited knowledge. This raises a deeper truth about Kitara's technological culture. The kingdom's mastery of ironworking was not limited to weapons and farming tools. Iron needles used in surgery were forged by specialist blacksmith guilds whose knowledge of metallurgy had been refined across centuries. Archaeological sites throughout western Uganda reveal ancient smelting furnaces and slag heaps, showing a long tradition of controlled high-temperature production. The same furnaces that produced hoes for agriculture also produced the fine instruments of medicine. Medical knowledge in Kitara was not separate from spiritual authority. Healers operated within courtly systems. Certain lineages were entrusted with surgical practice. Knowledge was guarded, transmitted orally, and protected by ritual restrictions to prevent misuse. This created a form of professional specialization long before formal medical schools existed. The use of herbal antiseptics was not accidental. The Great Lakes region contains thousands of medicinal plant species. Over generations, Kitara's healers built pharmacological knowledge through observation, trial, and communal memory. Certain herbs reduced swelling, others slowed bleeding, some prevented infection. These remedies were combined with alcohol-based cleansing in a way that mirrors the foundational principles of modern sterile technique. What Europe later called germ theory, Kitara had already approached practically. They did not need microscopes to understand that cleanliness prevented death. They learned it through lived experience. And Bunyoro was not alone. Across the Great Lakes region, similar abdominal surgeries were reported in Rwanda and parts of present-day Tanzania. In Uganda, these operations were generally carried out by male surgical specialists trained within hereditary lineages. In neighboring regions, women midwives were the primary surgeons, preserving and transmitting obstetric knowledge through female-led medical traditions. This variation reveals something crucial. African medical systems were not monolithic. They were regionally adaptive, gender-inclusive, and culturally embedded. Kitara's medical achievements were not anomalies. They were expressions of a broader technological worldview. Ironworking supported agriculture, which supported population density, which supported specialization, which allowed medicine to evolve beyond survival into practice. Navigation along Lake Albert and the Nile tributaries connected Kitara to distant knowledge networks. Trade routes carried not just salt and cattle, but ideas, techniques, remedies. Surgical knowledge moved with people. By the time Europe arrived to discover African medicine, Kitara's surgeons were already centuries deep into their own medical tradition. And perhaps the most unsettling part of this history is not that Africa performed surgery before Europe perfected antiseptics. It is that this knowledge was never recognized as science, only as a spectacle. What Felkin saw in 1879 was not a miracle. It was the survival of an ancient medical civilization. Kitara preserved history orally. Royal court historians, Abakuru Biebiafayo, memorized genealogies, treaties, famines, and migrations. These were not stories for entertainment. They were political memory systems. Religion in Kitara blended ancestral veneration with natural cosmology. Rivers were sacred. Iron was spiritually potent. Cattle were both economic and symbolic wealth. Trade networks connected Kitara to the Nile Basin, Great Lakes civilizations, and long-distance caravan routes. Salt, iron tools, cattle, and medicinal herbs moved through these networks, embedding Kitara within a wider African economic world long before European contact. Colonial disruption shattered Kitara's knowledge systems. Healers were dismissed, iron guilds dismantled, oral historians silenced. What Europe recorded as discovery, Kitara experienced as dismemberment. The Caesarean Felkin witnessed was not a beginning. It was a surviving fragment of a much older medical tradition. And perhaps the greatest tragedy is not that Kitara fell. It's that its knowledge was never allowed to be studied on its own terms. This has been the Calabash Diaries.